Why Ozempic's India launch is such a big deal? How it directly impacts not just public health but also economy. And is this the beginning of GLP-1 revolution in India? Ozempic has entered Indian market, a powerful diabetes and weight loss drug. But with the price that it has come, it raises many questions, not just about access, but also about public health concerns. Hello everyone, welcome to Vajiram and Ravi's Flash News. My name is Shubhangi Singh and today we are going to discuss Ozempic, not in terms of what exactly it does for weight loss, but to understand why it is important for India's healthcare system, how it can have an impact on economy, and also understand what exactly it does. So let us start with understanding that what has happened. So when we talk about the much talked about pharma, diabetes control, weight loss drug, Ozempic, that has been finally introduced by the company Novo Nordisk in India. So Ozempic is now available in India from this very month and it has been prescribed and suggested as a 1 weekly injection for type 2 diabetes management. So the starting dosage that has been told, it is around 0.25 mg, which is available for 2200 per week. That means one dose for a week is going to cost you 2200 rupees. That means for a month you will be approximately spending 8800 per month. And if you are prescribed a higher dosage, then your bill also goes higher. Now in this context, we need to understand that why it is being talked about so much, why Ozempic as of now its introduction in India matters so much. It matters so much because especially when we talk about India and the non-communicable disease burden it has, it is the diabetes capital of the world. That means as of now, India has 100 million diabetic people in the country. The rising obesity, the slow metabolism, they all are accelerating the non-communicable diseases burden. And as of now, our healthcare, be it any component around it, seems incapable to manage this. And in this regard, introduction of Ozempic seems like a brief respite because it might be able to specially address this problem in our country. But doctors are already giving warnings that this must be administered only under medical supervision, because Ozempic has not been just known for the diabetes control drug, it has been also known for its cosmetic purposes, the weight loss that comes with the usage of this particular drug. So now let us try to understand other dimensions around it, starting with what exactly is Ozempic and how does it work. So when we talk about Ozempic, it is basically a glucagon-like peptide 1, GLP-1 drug. So what does GLP-1 drug mean? GLP-1 drug is basically a natural gut hormone which helps in controlling blood sugar and appetite. Now in this scenario, when we talk about Ozempic, it is a GLP-1 RA. What does it mean? That it mimics what this natural gut hormone does. And because of this, it is able to stimulate insulin release only when glucose is high. It releases liver glucose output. It slows the gastric emptying. That means you will be full for longer, you will have lesser hunger or cravings, and it acts on brain's appetite center as well. That means overall it addresses the blood sugar levels and reduces your appetite. That is why its introduction has become important, because it ensures the control of blood sugar, which is important for type 2 diabetes, and it helps in controlling that. So this is how Ozempic exactly works. And because of that, we get to see improvement in HbA1c. For those who do not know what exactly is HbA1c, it is a blood test that shows your blood sugar level in past 2 to 3 months, which basically indicates that what is the long-term glucose control that is going on in body. It is very important for diagnosing diabetes or pre-diabetes situation. And it also facilitates, Ozempic further also facilitates significant weight loss in type 2 diabetes. It has multiple benefits for cardiovascular as well as kidney protection, and the 1 weekly dosage 0.25 mg that has been discussed. It improves adherence because daily tablets are something that you have to be committed to. So 1 week dosage is something that facilitates commitment, which is overall lacking across the Indian population that we get to see. Now in this scenario, Ozempic, how it works has been explained, what it does, what it can do has been explained. Now let us move to understand that why are we talking about, why are you placing so much emphasis on this launch. The first reason I have already explained, that India has a huge diabetes burden, non-communicable disease burden, and it is the world's second largest diabetic population that is present in India. And this diabetes problem is rising in young adults, urban poor, and women with polycystic ovary syndromes as well. And it is expected that there will be a sharp rise in next 15 years in diabetes, especially in these people in next 15 years. Furthermore, another thing that has been seen in India, prevalent in India, is the thin fat phenotype. That means your BMI might be showing you normal, that means in the thinner category. But if you check the presence of visceral fat, that means the fat that is wrapped around your organs, you will find that high. That means there are risks of fatty liver, there is risk of insulin resistance and metabolic syndrome. That means your metabolism will also be affected. In both of these scenarios, Ozempic can play a huge role and address these conditions. And furthermore, Ozempic can also be really helpful because it targets multiple metabolic pathways at once, and it will also reduce complication in cardiovascular diseases, chronic kidney diseases, neuropathy, retinopathy, all of this. That means diabetic patients who get to see a lot of impact in terms of neuropathy and retinopathy, that might also be addressed. And all of this makes Ozempic a one-stop solution injection and seems like an appropriate option that can be placed at the front to fight this non-communicable disease burden that India is battling as of now. Now let us understand the overall impact, how the prices are going to affect, how are we going to bring it into our health framework, and what are the options that lie in front of us. Starting with that, when we talk about the pricing of Ozempic, as I said, the monthly cost can range somewhere around 8,000 to 12,000. But if you look at the average monthly income in India, it is in the range of 13,000 to 15,000, and I am sure this is something very difficult to accommodate. And other alternatives from different other companies, be it Wegovy, be it Mounjaro, they are under the similar expenditure bracket. And this is something in the nations that it has been used, insurance rarely or to a limited extent covers it. That means there will be a lot of out-of-pocket expenditure, and which means a huge chunk of Indian population will not be able to afford this. And this is where we get to see that it will also have equity and accessibility concerns. And if we do not want this, there are options with the government to bring it under the Ayushman Bharat framework, state NCD programs, and also bring it under proper price regulation. Because if we are talking about Ozempic as the front warrior in the NCD framework, it will not be the front warrior at this given cost. Then the second dimension that is related to Ozempic, and it becomes important for us to understand, because again and again we are saying that it remains at the front, it might come at the front of the NCT war footing framework, because it has been associated with improved clinical outcomes, be it better HbA1c, reduced hospitalization, reduced burden on dialysis, reduced burden on cardiology and endocrinology units. That means overall burden on the healthcare system might say a dip. And when the dependence on healthcare system decreases, that means the long-term hospitalization costs will also decrease for the public. And this will also bring a strength to the overall NCD management, because we will get to see that there will be need for integrated metabolic care, and it will also have an indirect impact on economy. This will also require expansion of workforce. So when we are talking about NCD management, there are 4 important components that I am talking about. First, the dependence on hospitalization might decrease. That means there will be lesser hospitalization costs. Second, the change needs to come from integrated metabolic care and expanded workforce, but at the same time, behavioral changes are important. Higher compliance is required, and that will come with behavioral change. And most importantly, the caution that has been directed by doctors again and again, that this has to happen only under medical supervision. Addressal of NCD and the importance of Ozempic, all of this will not make sense if the directions are not followed. Now that brings us to another front, is the concerns around it. So as much as when we are talking about Ozempic and how it can play a great role on the diabetic front, on the NCD front, diabetic patients across the world are facing its shortages because it is also has a cosmetic misuse, which is because of which the demand is rising. And as of now, because of the high demand, supply crunch remains for the real patients as well. And that is why a huge regulatory challenge remains in front of us to curb the cosmetic misuse, to make sure that the real benefit of Ozempic is passed on to the diabetic patients. There should be no unethical marketing, there should be strict prescription control, there should be a strengthened pharmacovigilance, which is very much required, so as to ensure that accessibility and equity concerns that we were talking in terms of money, they are also taken in terms of need which is required. All of these dimensions overall leave it in a very questionable place. How it will play out in the Indian pharma market, in the Indian space, is yet to be seen. But Ozempic seems like a promising drug in this situation to address the healthcare concerns which are overburdening our systems as of now, and which have better ways to be addressed in another form, that is Ozempic. Now on this note, let us move to certain other dimensions and understand that how this can lead an impact on pharma industry as well. So when we are talking about pharma industry, another key component when I was discussing pricing, we have to understand that pricing can be affected by other players coming in. It can be affected by pricing control, which government can take up. Government can bring it under their insurance programs, and also if generic companies take it up, that is something that can impact the prices. In this very situation, if we talk about India's anti-diabetic market, it is something as big as 5 to 6 billion. And entry of this semaglutide pushes the market towards innovation-driven technique. And this innovation-driven therapies and options can also be an opening door for the generic companies. Other than that, this is the time we might see possible legal battles with the generic companies, which we are already seeing. For example, the Dr. Reddy's case, which is in front of us. It will also have an impact on employment, because as I talked about, it would need an expanded workforce and with skill development. For example, diabetic counselors, for example, obesity specialists, supply chain strengthening, cold chain logistics. So this opens a lot of scope for increased productivity and specialization across the market with increased employment as well. Apart from that, another factor that we need to consider is the social implication of Ozempic. This might actually change India's perception of obesity, where it is just seen as a lifestyle issue, but rather it is a metabolic issue, and that can be addressed but the core questions remain that the dependence on the high cost drugs will increase the healthcare stratification, and it will also take away the emphasis that should be on lifestyle changes. That means everybody will be looking for this one-stop solution rather than working and changing the lifestyle problems that exist. So all of this needs to be figured out. You let me know in the comment section what are your thoughts on this. Now moving to the practice question for the day. Put down your answers in the comment section if you have understood what has been taught. I am very sure the answer lies right in front of you. The answer for yesterday's question here is D. Now that was all for my side. Thank you so much.